So I'm going to be demonstrating a series of serratus anterior strengthening exercises. The serratus anterior is kind of an important scapular stabilizer. Essentially, to fire it up, you're protracting your scapula, but it's important for your patients with scapular dyskinesia, maybe some rotator cuff pathology or just shoulder pain, and you are suspicious that serratus anterior might be weak. So the first one I'm going to demonstrate is kind of a push-up plus, is what they call it, and there's kind of a series of progressions you can do to advance your patient depending on their ability. But the first thing I would do is go to a wall. So kind of the easiest way is to be standing up, going to a wall, and essentially doing a push-up standing up, but not doing the push-up. You're kind of doing the push-up motion in your shoulders. So you're just rocking your shoulders forward, kind of pushing your body away from the wall, coming back. So again, keeping your elbows straight. So that's kind of one way to do it. You can progress by kind of leaning onto this table and doing the same thing. So again, we're just rolling my shoulders back and forth. And to progress this more, I can get on the table here and I'll be on my knees and just kind of work on doing that same thing, just protracting the scapulothoracic joint and retracting, but more of that active protraction. And then you can get off your knees and kind of do it. So yeah, so the sets and reps will just depend on the patient. You just do, your 3 sets of 10, 2 sets of 20. See how you want to progress from there. The other one is the dynamic hug. So this one is just simply coming across and just protracting your scapula. So it's kind of hard to tell from this direction. I'm just kind of trying to reach forward. So the way you can progress this is to get a TheraBand and just kind of work on doing the same thing. So this is a very light TheraBand. You can progress from there kind of deal. You're just really aiming to protract that scapula. And that fires the serratus anterior. So this last one is called the serratus punch. And we kind of do this at 120 degrees of flexion. So I'm going to lay down here, bring this weight up overhead, and I'm going to be at about 120, what I think is 120 degrees, and then just work on kind of punching the ceiling. So I got this 2-pound dumbbell. Eventually we can work our patient up to more weight as needed, and adjust these sets and reps as necessary.